I looked through your chart and I noticed that you have a bit of anxiety and some insomnia and lately you've been feeling really fatigued and run down and you're just not getting good sleep. And there's a number of issues that go on with that we can talk about, but you have a little bit of anxiety and your fatigue is all day, and then you've been having some digestive issues too, like bloating and cramping.
That's exactly right.
So there's a number of things that go into your general well-being that we look at. I'll do a physical exam on you, and then we will do some blood work, and then there's a lot of different issues that go on with people feeling fatigued. It can be a lot of mental, emotional issues, and then some physical issues. So we'll be looking at your hormones. Maybe you have low testosterone, maybe your thyroid's off. A lot of time people get what's called adrenal burnout, where their adrenal glands can get burned out and they become very fatigued and tired and they actually feel burned out. So we'll be looking at all those, and then there's some nutrient issues that can go on too, because if people are deficient in very important nutrients that help the mitochondria to make energy, then they're going to feel fatigued and run down. So we'll be looking at that in the blood work. And we'll look at your hormones and make sure you don't have diabetes. And then we'll look at some of the nutrients. And then at that point, what we'll see is where you're at, and we'll put a roadmap together. And from there, you can figure out where to go with this. I know a lot of people will go online, and they'll see that there's a lot of different things to do for this and that, and they're really not quite sure where to go with it. And that's what our job is. We're here to put a roadmap together specifically for you based on the blood work and your symptoms and what's going on with you. And then if there's some digestive issues, I'll have you see the nutritionist that we have in-house. And at that point, it's kind of 20% us, where we tell you what's going on, where you're at, and then it's 80% you in getting the work done, dealing with stress and things like that, and some of it's physical. It's very major and very important that you're here and actually made a decision to change your health, and that's what we're here to help you with.